Hi, let's talk about mentoring and nurse anesthesia. Do mentor nurse anesthetists versus non-mentor nurse anesthetists differ by level of job satisfaction? Hi, I'm Patricia Tharp. I'm a DNP student at Arkansas State University. My mentor is Dr. Christopher Jordan. So let's look at mentoring and nurse anesthesia. Currently, there's an inadequate supply of certified registered nurse anesthetists, especially due to the coronavirus. Mentoring is needed in anesthesia in order to increase job satisfaction, increase retention, and prevent turnover. And looking at the review literature, there wasn't a whole lot of literature out there in regard to mentoring nurse anesthesia. Most of it tend to focus on the new RN or F&P. Mentoring itself can change the practice of anesthesia. Now, my question again is, how do mentor nurse anesthetists versus non-mentor nurse anesthetists differ by level of job satisfaction? Let's answer that. My purpose was to measure mentoring among CRNA as it relates to job satisfaction. So I used convenient sample CRNAs working full-time at Gastro 1 Surgery Center in Germantown, Tennessee. My objective was to measure the importance of mentoring as it relates to job satisfaction among CRNAs. So I use Patricia Bennett's theoretical framework. It goes all the way from the novice to the expert. This just goes over her method here. Now, my project design was to implement a mentoring and job satisfaction survey, assess the need for a formal mentor program to improve job satisfaction, retention, and reduce turnover among CRNA and Gastro 1. My methodology: each CRNA received an informed consent, demographic survey, mentor survey, and courses and miles of nurse practitioner job satisfaction scale. Data collected was used to assess the importance of mentoring on job satisfaction. This just goes over the tools that I use to measure mentoring and anesthesia. This is my demographic questionnaire, my mentoring questionnaire, and of course my miles of nurse practitioner job satisfaction scale. And it goes on. Now, my methodology: day one, they were issued informed consent, the mentoring and job satisfaction survey. Days 2 to 5, they were allowed to ask questions. And days 5, I collected my information in a sealed envelope. Now, sampling setting: I used convenient sample of 12 CRNAs employed 40 hours or more at Gastro 1. CRNAs were greater than 25 years of age. Participation was voluntary. Okay, data analysis: I used Excel, SPSS. My 44-item miles of nurse practitioner scale was able to score a 0.96% Cronbach's alpha, which was precisely the same thing as the original scale. Yay! Okay, now this just breaks down my sample. Now, and looking at the data analysis, 100% of the respondents who had a mentor from high positively influenced that mentoring positively influenced their job satisfaction. So we definitely need some more mentoring. This just goes over my analysis. Now, looking at the DNP Essential Doctoral Nursing Practice, I like to think about DNP Essential 1 as the novice, going all the way to the expert. That's DNP Essential 8. That's when the novice becomes the expert. Patricia Bennett certainly would agree. Okay, financial budget: Gastro 1 is currently implementing a new 5-day mentoring program for all new high CRNAs. Yay! Now, looking at the costs, mentor nurse anesthetists are more cost effective than non-mentor nurse anesthetists because you don't have to pay for all that turnover. Now, protection of human subjects: each CRNA filled out informed consent. No names or identifying information was given. It was kept on a lock and key. After 30 days, it was shredded. Okay, evaluation plan: all subjects reported that mentoring positively influenced their job satisfaction. So we need some more mentoring. This finding was shared with the chief CRNA. Gastro 1 is currently implementing a 1-week mentoring program. Yay! Okay. Now, recommendation: I need a larger sample of CRNA, user-friendly, well-based tool to measure mentoring and nurse anesthesia. Lesson learned: explain the purpose of the study to each participant. Recruit as many subjects as possible, and definitely get a mentor. Now, in conclusion, to answer the PICO question, how do mentored nurse anesthetists versus non-mentor nurse anesthetists differ by level of job satisfaction? The answer is mentor nurse anesthetists reported greater levels of job satisfaction than non-mentor nurse anesthetists. So it answered my question. Thank you so much.